Have you ever spent the whole night in bed just trying to find a position that doesn't cause back pain? Or have you been going from one hospital to another, trying every kind of medicine, yet the pain keeps coming back, nagging, persistent, seemingly challenging your patience? If you are on that journey, stay calm. You are not alone. Millions of people are also seeking the answer to the same question. Why does disc herniation treatment often fail? In this video, I, as a physician, will help you understand the truth behind the pain, analyze the common mistakes that lead to recurrence, and most importantly, show you the true path to recovery and prevention. Please take a few quiet moments for yourself. Let me tell you about your own body and the reason why it has not yet been able to heal. Disc herniation is no longer a disease exclusive to the elderly. Today, even young people aged 25 to 35 are beginning to feel back pain, leg numbness, and neck and shoulder fatigue, the first warning signs that their discs are crying for help. Some experience transient pain that eventually resolves, but others treat it at various places, year after year, yet the pain remains relentless. And the biggest question still echoes: why does disc herniation treatment often fail? Disc herniation is a condition where the nucleus pulposus, the soft center between two vertebrae, escapes its normal position, pressing on the nerve root, causing pain, numbness, muscle weakness, or even paralysis. However, the deep-seated reason why the condition is difficult to treat lies not only in the herniation of the nucleus pulposus, but also in how we understand and treat our bodies. Many patients immediately resort to painkillers, medicated patches, acupuncture, or certain exercises shared by word of mouth when they feel back pain. Initially, the pain subsides, but just a few weeks later, it returns, more persistent and severe than before. This makes them think that this disease is incurable, when in reality, they never took the right approach from the start. A disc does not degenerate spontaneously. It is the result of a prolonged degenerative process caused by poor posture, lack of physical activity, or overexertion. When only focusing on the pain and forgetting the root cause, which is spinal imbalance, the results will only be temporary, even with injections or surgery. People with disc herniation often receive a lot of contradictory advice. Some say absolute rest is necessary, while others advise vigorous exercise. Some follow Western medicine, while others turn to traditional Eastern medicine or folk remedies. All of them desire one thing: to be pain-free, numbness-free, and walk as before. But very few understand the spine's self-healing mechanism and how to facilitate sustainable recovery. The most common mistake is treating the symptoms, or the branches, while neglecting the root cause. When back pain occurs, the natural human reflex is to want immediate pain relief. Therefore, the majority of patients choose painkillers, anti-inflammatory injections, or hot compresses. These measures are actually very helpful in the acute phase, providing temporary relief for the patient. However, if they stop there and don't seek the real cause, the condition will recur after a short period. Disc herniation is not just about the disc. It is the result of overall imbalance, weak back muscles, abdominal muscles unable to support the spine, incorrect sitting posture, a sedentary lifestyle, and being overweight. When pain is only relieved without restoring the strength of the musculoskeletal system, muscles, bones, and ligaments, the disc continues to bear pressure every day. It continues to be compressed and torn, and the nucleus pulposus protrudes again. Another mistake is the overuse of medication and pain injections. Many people receive epidural injections or use continuous corticosteroids. While this temporarily makes the pain disappear, it gradually weakens the tissues around the spine, severely reducing the body's self-healing ability. The disc needs
front of the
time to
spinal
heal,
discs
just like a wound
compress.
needs to close. By forcing it with medication, we are delaying the natural
And this
recovery.
can cause
No small number of
instability, as
people
you can
opt for
see
absolute
in the
rest.
lower
They
region
are
of the
bedridden for
spine.
weeks, fearing movement because they fear pain. But the truth is, the more immobilized the spine is, the weaker it becomes. Unused muscles atrophy, blood circulation is poor, and the disc becomes nutritionally deprived. This worsens the condition rather than alleviating it. The secret to successful treatment is a multimodal approach.
Proper
Correct pain
spinal
management,
alignment is
appropriate
key for a
rehabilitation
restful night.
exercises at the right stage, and daily postural correction. This is not curing, but a journey of restoring spinal health. Many people hear that exercise is good, but perform exercises at the wrong time
If
and
there's
with
any
the wrong
questions at all,
movements.
you just let us
When the
know.
pain is still acute,
Respiration,
attempting
just let us know.
strenuous exercises, forward bending, or sudden twisting will cause the disc nucleus to protrude further, leading to more severe damage. Conversely, once the acute phase is over, remaining immobile and refusing to engage in gentle movement
Today,
leads
we're
to weaker back
exploring the
muscles, a
incredible
poorly nourished
structure of the
disc,
human
and the condition
spine.
cannot recover. Exercise for disc herniation patients requires a clear understanding of the biomechanical principles of the spine. The disc is like a sponge. It absorbs nutrients through gentle movement, not through blood vessels. When we move correctly, the vertebrae rhythmically expand and contract, helping to pump blood and water back into the nucleus pulposus, reducing internal pressure. However, just one wrong forward bend and the entire compressive force is focused on one point, causing the nucleus pulposus to protrude further. Rehabilitation exercises must be guided by a physical therapist. In the initial phase, the goal is to reduce pressure on the spine with gentle stretching and lying down positions. Only then should one progress to strengthening the back and abdominal
This is your
muscles
lumbar
to create a
spine
stable,
here.
supporting
Yes.
framework.
Yeah.
A healthy spine is
And
not
this is where we
maintained
see
by
the
medicine,
compression.
but by the muscles surrounding it being strong enough to
And building
maintain
that muscle
balance.
strength is really
Another
important.
common mistake is following social media exercise videos without understanding one's own body condition. Some exercises that are good for one person may be dangerous for another. Each herniation location, cervical, thoracic, or
Let's fix your
lumbar,
posture a
requires
little bit.
specific
Sit up
exercises.
straight.
Without an MRI diagnosis or clinical examination, self-training can lead to more serious damage.
The human
A
spine
good
is
doctor will not
complex
only
structure
prescribe
designed to
medication,
support
but
the
also
body
guide the
and protect
patient
the
on how
spinal
to live
cord.
with a healthy spine. Because the disc cannot be glued back like an object, it requires the patient's cooperation in every small habit: how to sit, stand, lift heavy objects, and sleep.
And slowly
No small number
come
of
back
people,
up.
due to severe pain and exhaustion, have fallen for advertisements claiming to cure disc herniation in 7 days. No surgery, no medicine needed, or just use a secret herbal poultice and
This
it's
digital
cured.
display
Such
is not
invitations
just for show.
prey on the patient's desperation, but pose a huge risk.
Yes, sir.
Disc herniation is a mechanical, structural pathology. Once the nucleus pulposus has extruded, no oral or topical medication can pull it back in. The goal of treatment is to reduce inflammation, alleviate pain, restore function, and prevent recurrence, not to eliminate the
Our
herniated
treatments
disc.
are at the forefront of
Unidentified
medical
traditional
science
medicines
and
and
completely
uncontrolled
tailored to your
manual
individual
manipulation
needs.
methods can lead to severe complications: further tearing of the annular fibers, limb paralysis, or spinal cord damage. Patients need to understand that modern medicine offers many safe and effective methods, from physical therapy, laser, spinal decompression, to endoscopic surgery, but there is no
Laser
miracle
therapy,
cure in a few
shockwave
days.
therapy,
What is
all
more frightening
non-invasive,
is the loss of
painless,
faith in
with no side
physicians.
effects,
After
and
several
highly
attempts at
effective.
incorrect treatment, Patients think, Western medicine can't cure it, Eastern medicine can't cure it. I guess I'll just live with it for life. But in truth, they have never followed the correct protocol. If properly examined, accurately diagnosed with imaging, given a clear treatment plan and followed up regularly, the current recovery rate for
Slowly.
disc herniation is very high, up to over 90% with
exhale.
conservative treatment. There is no shortcut to
Just
health.
a couple of inches
The spine needs daily
Okay.
care through
Okay.
understanding,
back, and then you wanna
patience, and
slowly
discipline.
Control it
Patients
forward.
need to learn how to live right rather than cure quickly. Once we understand the mechanism of the disease, we realize that disc herniation is not a dead end.
When
It's
we
the body's
sit,
warning.
when we
Stop
stand,
and take
even
care
when
of
we
me
sleep.
correctly.
So when
Successful
you're actually
treatment
doing
lies
these
not
small
only in medication
changes,
or machinery, but in the conscious change of lifestyle. Everyone needs to relearn the habit of physical activity, sit with correct posture, walk daily,
Are you happy
control
now?
weight, and maintain a positive attitude. The spine is the main axis of the body. When it's healthy, the whole body is healthy. A person who was once in too much pain to bend can return to a normal life after just 6 months of correct exercise. This is not a miracle, but the body's power of self-healing. The most valuable lesson disc herniation teaches us is to understand our bodies better. When we understand the true cause and know how to prevent it, even before getting sick, we are protecting ourselves from future pain. And if you are hearing these
It was a
words,
pleasure to
perhaps
meet
you
you.
or a
Well,
loved one is
you
on
too.
that journey. The journey to regain a healthy back, a full night's sleep, and a step free from the fear of pain. Do not lose faith. Start today with understanding, patience, and love for your own body. Because treating disc herniation is not about defeating the disease, but about learning to live in harmony with the spine, the foundation of human life. If you have listened this far, you have probably realized treating disc herniation is not just a journey of cure, but a journey of relearning how to love your body. There is no miracle overnight, but every day you can do one small thing to be better. Sit a little straighter, exercise a little more consistently, rest a little more adequately. And those small steps, little by little, will accumulate into a life free from the fear of pain. Remember, your disc is not betraying you. It's just telling you that you've forgotten to listen to your body for too long. Thank you for your time with this video. If you found this helpful, please share it with loved ones, because a small video might just help someone escape the pain they have carried for years. I am Dr. Minh. See you in the next videos where we heal together, from understanding to action. Navigating the system, a Western perspective on chronic back pain, expansion. For patients in the United States and Europe, the journey with disc herniation is often complicated by two primary factors: the complex medical system and the culture of quick fixes. Successfully navigating this chronic condition requires patients to become educated advocates for their own health, a concept deeply rooted in the Western emphasis on patient autonomy. The challenge of the quick fix culture. In societies driven by immediate results, there's a pervasive expectation for instant relief, often fueled by pharmaceutical marketing. This feeds directly into the mistake of treating the symptoms discussed earlier. Many patients enter the healthcare system demanding strong opioid pain medication or immediate surgical consultation, bypassing the critical yet slower process of conservative care. However, the Western world is grappling with an opioid crisis, directly linked to over-reliance on pharmacological pain management. For disc herniation, the medical community, guided by organizations like the American College of Physicians, ACP, and European guidelines, now strongly recommend starting with non-pharmacological treatments, specifically heat, massage, acupuncture, and most importantly, supervised physical therapy, PT, before resorting to medication or advanced imaging like MRI unless red flag symptoms like progressive neurological deficits are present. This shift reflects a move away from passive treatment, pills and rest, towards active care, movement and functional restoration. Empowering the patient, the multidisciplinary team approach. In a well-structured U.S. or European healthcare model, disc herniation treatment is rarely the domain of a single doctor. It's a team effort that relies heavily on a multidisciplinary approach. This team typically includes 1. Primary care physician, PCP. The initial contact, ruling out serious causes and managing acute pain. 2. Physical therapist, PT. The central figure in conservative care, crafting an individualized exercise program that addresses the patient's specific biomechanical faults, weak core, tight hips, poor movement patterns. 3. Physiatrist, physical medicine and rehabilitation specialist. A non-surgical spine specialist, you can perform targeted epidural steroid injections, ESI, used to manage severe nerve root inflammation and oversee the overall rehab process. 4. Neurosurgeon or orthopedic spine surgeon, reserved for cases that fail extensive conservative care, typically 6 to 12 weeks, or those presenting with emergency symptoms like cauda equina syndrome or progressive weakness. The key takeaway here, especially for the Western patient, is the empowerment of the physical therapist. Unlike many Eastern systems where exercise is an adjunct, PT in the US and Europe is the first-line treatment. Patients must view their physical therapist not just as an instructor, but as a partner in rebuilding their spinal stability. The necessity of lifestyle integration.
Sit up straight.
Finally, cultural norms around work and fitness must be addressed. In Western corporate culture, prolonged sitting, the new smoking, and the pressure to push through pain are common pitfalls. Effective recovery requires a conscious cultural shift, adopting a movement is medicine mindset. This means integrating ergonomic best practices, sit-stand desks, proper chair support, into the modern office, and recognizing that exercise isn't just a gym activity. It's the daily, consistent application of good biomechanics, lifting with the legs, maintaining a neutral spine, and taking micro breaks from sitting.
Good.
For the European and American patient,
And
the
exhale.
success of their disc herniation treatment
Very good.
ultimately
Just a couple of inches
hinges
back.
on their willingness to trade the
Okay.
passive hope
And then you
for a
wanna
magic
slowly
pill
control it
for the
forward.
active, disciplined
Are you
work
happy
of
now?
spinal maintenance
I
and
am.
functional restoration.